Hi, my name is Evelyn. I'm one of the gynecology doctors. Can I just check what your name is?
Yeah, it's Bethany Smith.
Perfect. And how old are you, Bethany?
I'm 23.
And am I okay to call you Beth?
Yeah, that's absolutely fine.
So, I know you've previously been seen in pelvic pain clinic, and just to recap, you're struggling with pelvic pain that's constant, but particularly worse when you're menstruating. It also gets worse when you're opening your bowels and when you have sex. The last time, I think my colleague examined you, and I think we suggested the possibility of endometriosis, and we organised an MRI scan just to confirm that. Is that right?
Yeah, that's right. So I went to pelvic pain clinic and I've had the MRI scan now, and I believe this appointment was to kind of go through the results and talk about further treatment options.
No, absolutely. So the MRI results do confirm that it's most likely endometriosis.
Okay.
There's two specific things that we saw on there. The first thing being there's a 5 centimetre cyst by your right ovary that possibly contains endometriosis.
Mm-hmm.
As well as that, we also saw that between your uterus and your bowel, there's some kind of scar tissue, which is possibly caused by the endometriosis as well.
Okay. Yeah, that kind of makes sense because I've had a lot of my pain on the right hand side particularly.
Okay. Is there anything in particular that you had in mind in terms of treatment options or anything that someone else discussed with you already?
Yeah, so we talked a little bit about the various options and also surgery, which was dependent on the results of the scan. If it's still possible to go through surgery, that's kind of what I'm leaning towards.
Okay, absolutely. I can speak to you about the surgery. So the surgery involved with endometriosis is a laparoscopy and excision of endometriosis, which is just another way of saying it's a keyhole surgery to have a look inside and see if we can see an endometriosis, and whatever we can see, we remove.
Mm-hmm.
So obviously with any kind of surgery there's risks and benefits, and I'll explain all the risks to you, but ultimately it's for you to decide whether the benefits outweigh the risks. So do you want me to just talk a bit more in detail about the risk of surgery?
Yes, please. Yeah.
So the kind of main things I wanted to mention to you was pain, bleeding, infection, and an increased risk of clots in your legs and your lungs.
Okay.
And we do a few things during and after surgery to kind of minimise the risks of that as well. The other kind of more rare but serious risks that I wanted to talk to you about is that there's a potential of injury to some of the surrounding structures next to your uterus.
Okay.
Particularly because you have endometriosis and a little bit of scarring, I always like to highlight that to you as well.
Okay.
So next to your uterus you've got your bowel, your bladder, and then you've got your ureters, which are the tubes that carry the urine from your kidneys to your bladder.
Okay.
Obviously they are rare complications, but we need to tell you about them because they can have serious complications and implications on your life.
Right.
For example, with like kind of any damage to the bowel, you might have end up with something like a stoma bag. Do you know what that is?
Yeah, actually my grandfather had one. Obviously not ideal, but as you said, it's a rare outcome.
I just need to, yeah.
And I think as well, I've kind of got to the point where I don't feel like the other treatment options are or would be beneficial for me. So I do think I want to go for the surgery.
Absolutely, that's absolutely fine. If everything goes well with the surgery, then you can go home the same day. And generally speaking, you get better each day after surgery. There are some complications that can occur after surgery though, so we always say if you don't feel well or if you feel like things aren't improving, then you should always come back to us and we'll see you.
Okay, are there any other risks?
So the other thing that I needed to mention to you is that obviously with endometriosis surgery, it's not necessarily 100% successful. So 8 in 10 people find that there is an improvement in their pain, however 2 in 10 don't find that their pain hasn't actually improved.
Okay. And what are the risks of not having the surgery? Because I know you mentioned like in the report that I have a cyst, and I know that cysts can sometimes be cancerous.
The MRI scan didn't show any signs that the cyst is actually cancerous, and generally speaking, cysts containing endometriosis have less than 1% chance of turning into a cancer. However, the only way to know for sure is to take the cyst out and kind of check it under a microscope to be 100% certain that it isn't cancer.
Right. Yeah, so I think for me, I do want to go for the surgery because I have, I've kind of exhausted all the other options. I'm on loads of painkillers and hormones aren't an option for me. So I think surgery is the best way forward.
Just for my own knowledge, is there a reason why hormones weren't working for you, or have you tried it at all?
Yeah, so I recently got married and we want to start a family, so I am kind of hoping that the surgery will help with the pain that I've been experiencing whilst having sex.
Okay.
but I am also concerned about the potential effects of the surgery on fertility. I don't know if you could talk to me about that.
No, that's a really good question. So, any sort of pelvic surgery, especially around the ovary, has a possibility of reducing your ovarian reserve, which is basically reducing your number of eggs. However, endometriosis and infertility actually go hand in hand, and having a cyst that contains endometriosis reduces your ovarian reserve as well. So we find that with our women, having endometriosis surgery to kind of remove endometriosis actually improves your chance of spontaneously getting pregnant.
Okay. And after the surgery, how soon is there like a recommended period after which we should start trying, or?
So not necessarily. So essentially, it's just whenever you feel like you're ready to start trying post, when you feel like you've recovered well enough. But we do say that the best results usually happen about 1 year, between 1 year of surgery.
Oh, okay, great. Can you put me on the waiting list?
No, absolutely. So I can put you on the waiting list today. I will also give you contact details for our lovely endometriosis specialist nurse. So if you have any issues in the meantime, you can always contact them as well.
Great, thank you so much.
All right.